pregnancies too.
My name is Puratu Ain binti Ashari. My matric number is 2419958.
My name is Siti Nurbahia binti Muhammad Tarmizi. My matric number 2412010.
Breast cancer is a kind of cancer that begins as a growth of cells in the breast tissue. Breast cancer is one of the most common cancers worldwide. Unfortunately, many people ignore it or feel shy to talk about it, thinking it's embarrassing or it only happens to others. Most women only discover that they have breast cancer when it is already in its late stages due to lack of awareness, lack of information, and lack of access to physicians, because the subject of breast cancer is unfortunately still a social taboo in most parts of Malaysia. Breast cancer can affect anyone. While it's more common in women, men can also develop breast cancer even though it's rare. That's why awareness is very important, because early detection saves lives.
When breast cancer is detected early, treatment is often more successful. But if people stay quiet out of fear or shame, they risk finding it too late. That's why we encourage everyone to know their own body and practice breast examination or BSE. It's simple, private, and helps you notice early changes.
The best time to perform BSE is during 7 to 10 days after menstruation begins, or on a fixed date each month for postmenopausal women.
So now, let me teach you how to do breast examination. Let's go! First, stand in front of a mirror with your shoulders straight and your hands on your hip like this. Take a good look at your breast and check for any changes in size, shape, skin texture, and appearance.
And next, raise both arms above your head like this and look again. Check for any visible changes and watch for any fluid or discharge coming from the nipples.
Then, lie down comfortably and use the backs of fingers to examine your breast. Move your fingers in small circular motion, covering the entire breast and armpit area like this. Feels for any lumps, thickening, or unusual changes like dimpling on the skin.
Finally, repeat the examination while standing or during a shower. Many people find it easier to feel changes when the skin is wet and slippery. Be sure to cover the entire breast area and the armpit area.
Don't let chances of fear stop you from protecting your health. Talking about breast cancer often hyperactive stigma. BSE is not a replacement for medical checkup, but is a powerful habit for early awareness. If you notice anything unusual, alarm, discharge, or changes in the skin, don't worry. See your healthcare professional. Together by speaking out and checking regularly, we can save more lives.
Awareness is the first step towards saving life. Together, we fight breast